The growth, any growth for that matter, can be attributed to kapha. If it's a growth that's gone haywire, it's not normal, it's irregular. So the irregularity, like cancers and stuff, they would have a lot of vata as well, because it's division but it's gone haywire. Your body cells are trained to divide, but when one cell goes off, it's supposed to die a death. The process is called apoptosis or programmed cell death. The moment any of your cell in the body turns crazy, it's supposed to die, because it doesn't identify with self anymore. But when the process itself stops, when you lose that self-identification, when you lose that ahankar, like it's in opposition with that, that can take an independent identity, right? It can pull from your own body. So what a lot of cancers, if you've seen like tumor-related cancers, they're pulling nutrition, but they have an identity of its own. They're just gaining nutrition from all your blood vessels. So once the blood is involved, it's also the pitta or the rakta. When there's growth, because it's pulling nutrition, that's the kapha. Then there's the division of cell, like it's rapidly multiplying, but for which it has to divide the cells, right? So that's also vata. So depending on what condition you have, what's going on, it could be a little different. Any cancers in the bone, because bone is a vata place. So any cancers in the bone would predominantly be vata. Your liver cancers, because liver is a pitta sthan, it's a place of pitta. So that is going to be predominantly a pitta issue. At what spot, right? Like, so it's, if it's the upper part, if it's your stomach, if it's the upper part of the stomach, like it's mainly kapha. If it's your small intestine, it could be more of the pitta issues. If it's any of the biliary tract cancers and stuff, those could be pitta issues. If it's anywhere in the large intestine, any polyps, they're all related to vata. So depending on what place, what seat you're having issues, they can change, like you can determine the vata. Sure.
How about some common ones like breast or prostate cancer?
So what's breast? Okay, why? Okay. It's a reproductive, but does it really have like reproductive functions? What's the function of breast? Yeah, so it's more closer to rasa, right? We talked about milk, breast milk, being a subtissue of rasa. So your breast is going to be an accessory organ, but it will work more with rasa. So breast cancers, if you're not having a good diet, that itself, like that's where everything starts.
And the same would go for prostate too then, right?
Yeah, because it's the nourishing principle, right? Because a lot of the sperm production and stuff that would take place in the testicles. Your prostate mainly has the nourishing principles.
And
yeah.
So once you can identify where the disease or illness is located or in what dosha, then where do you go? You look at the opposite.
You try to bring a balance.
Yeah.
So with people, what's happening when you grow old? For example, there's a lot of incontinence issues. You cannot hold your bladder that well. Muscles start losing tone, right? Mm-hmm. So everything is kind of not as strong, not as sturdy. So yeah, so then you would maybe use astringents to tonify the organ, because there's earth giving the stability and there's the air that's pulling excess liquid, so everything's stable foundation.
So give an example, I guess.
Yeah.
What you're saying.
What, if you give me an example,
Well,
yeah.
just a general question, actually. Like just in terms of how to look at possible.
See, okay, with cancer maybe, people who are going for radiation therapy or chemotherapy, what is chemotherapy? Which dosha is it like? And what are the side effects?
Vomiting, nausea, loss of hair,
Mm-hmm.
skin issues.
Mm-hmm. There could be a lot of burning, right? You're still having chemicals inside your body which could create a lot of heat. They're trying to kill the cells, so it's like full on you're attacking them. So then you're going to try having ghees in your diet, have more clarified butter, try to cool the system.